Hi there, my name's Shannon Christen. I'm a registered dietitian and diabetes care and education specialist. I work at the University of Colorado Endocrinology Clinic as well as the Heart and Vascular Clinic. This is my case report on severe insulin resistance and how to navigate an insulin pump in a person with visual impairment. I have a 44-year-old male with Alström syndrome causing severe insulin resistance, blindness, and hearing impairment. He's been my patient for over 5 years. He has high insulin requirements in the 350 to 400 units per day, but we are using U500 in his insulin pump. His hemoglobin A1C historically has been between 8.2 and 9% without hypoglycemia. He's intolerant / hesitant about GLP-1 receptor agonists and other anti-diabetes medications. So we became kind of short on what to do next on time. His original Medtronic 722 pump was starting to show wear and tear, and it was out of warranty. And so we had multiple conversations every 90 days talking about what we would do if this pump failed. And in addition to that, what other opportunities would he have to continue on to insulin pump therapy? And so we kind of compared and contrasted different insulin pumps, and we landed on a decision based on total daily dose, the insulin's capacity in the cartridge, the use of the VoiceOver app, if he could remote bolus. So he uses an iPhone, and so he is able to bolus using the VoiceOver app if the app is compatible to VoiceOver. The locking mechanism of the pump, as you know, that all the insulin pumps have a locking mechanism, and so we would need to figure out one that he could maneuver, the type of CGM device, and the infusion set type. So what we ended up doing is determining that he was going to move on to a Tandem X2 with Control IQ, and we initially started with a Dexcom G6 sensor. How we came up with our settings is we took his total daily dose of U500 and we readjusted it to U100 insulin doses, trying to keep in mind that his total daily dose of insulin on Control IQ, the maximum on that is 100 units. So we decided to redistribute his basal to be about 40% of his total estimated needs. And then we would take 50% of that estimate and have him take a U200 insulin degludec daily injection, and then have the remaining amount run in his insulin pump. We then adjusted the bolus to be about 60% of his total estimated needs, with the correction factor being 3 times the carb ratio estimate. We went on to convert all these numbers that were going to go into the pump to U200 Lispro concentrated insulin settings. And we did this in a staged approach. And so the first week before we did the live start, we actually did a saline pump start, and we had him practice the VoiceOver bolusing. We practiced how to fill an infusion set with saline and an insulin pen, because U200 Lispro only comes in a pen. We reduced his current pump basal settings in his Medtronic 722 pump by 84 units and had him started a loading dose of 84 units of U200 insulin degludec, figuring that by the time we saw him the following week, he would already be at steady state. And then we additionally started him on a Dexcom G6 CGM. On the following week, we did a live start and we assessed his VoiceOver bolusing, troubleshooted any questions or concerns that he and his mom had. We assessed the impact of the U200 insulin degludec onboarding, and we determined it was doing very well, and we had no concerns to continue on the dose we estimated. We set up the pump and went right into Control IQ, and we connected into our clinic portal for following of his insulin pump in case we needed to make any insulin adjustments based on the data we were seeing. This is a comparison chart of his Medtronic non-AID system versus his Tandem X2 with Control-IQ, U200 Lispro, and U200 insulin degludec. What I'd like to point out here is that his insulin needs on U500 were around that 70 unit range. And you can kind of see here from the glucometer report here of what his estimated glucoses were. And then on the right is his sensor data after being on the Control-IQ pump and how he was spending his insulin. And we estimated he was probably going to need over 100 units of bolus insulin, even with U200 Lispro. And he, based on this, is estimating in about that 66 unit range. And then keep in mind, he's still got that daily injection of insulin degludec. But overall, very happy with his transition and did not experience hypoglycemia, and his target range was improving over time as he continued on therapy, and we made some small changes. We did some very conservative carb to insulin ratio and correction factors, figuring we could slowly titrate them so they would be more specific to his personal needs. In conclusion, there are a lot of limiting factors for a patient with visual impairment, and there's not a lot of choices. And so when I was trying to rack my brain for ideas, this seemed like the best choice based on those indications we reviewed above. His severe insulin resistance is it also a complicating factor in this? And we needed to leverage technology, but we also had to create workarounds. And this is not easy, but it's necessary. It's a surprising situation for those patients that have visual impairment that still to this day, we don't have a lot of technology or resources for these folks. And so I hope this presentation highlighted an option for maybe your patients. I hope you've enjoyed my case report. I have always enjoyed working in this content area, and in addition, being a part of diabetes care and education. Thanks for your time.